I have recently been told that I have wet macular degeneration as well as dry macular degeneration. Nobody seemed to focus for a very long time on me having dry macular degeneration. All the doctors had always focused on the wet. So it was very surprising when one particular organization said, no, you actually have a combination, wet and dry macular degeneration. I was originally diagnosed with wet macular degeneration November the 11th of 2014. Nobody ever talked to me about dry AMD until I went to the National Eye Institute in Bethesda, Maryland. I've been around. And I think that was closer to, I'm guessing a little bit, but not till 2017. He was the first physician that said to me, no, actually you have both wet macular degeneration as well as dry macular degeneration. I was an emergency room nurse in the city of Philadelphia. High impact, high trauma. I went to document on a patient's chart and couldn't see the sentence that I had typed. And it was, you get like a sinking gut feeling, like, what is going on? I had no idea of what was going on with me. It was a short period of time from that day to when that wonderful November the 11th came. And when the doctor walked in and explained to me what was going on and that he didn't use medical terms, I had blood behind my eyes and I have a big scar and they're going to give me needles in my eyes to see if they can get my vision back. Well, I felt like my world was collapsing around me. Nursing was a second career for me, but I raised my children and then went back to school, became a nurse, loved what I did, loved where I did it. And I just felt like my whole life was just crashing around me. Being a nurse, I was the one that was always the helper. So I was always helping everybody else. And now I've had to learn to ask for help, and that's been very difficult for me. So I've made friends from my gym that this time of the year, everybody knows certain classes that we go to consistently, I need a ride. Somebody has to, come and get me and then get me home, even though it's only around the corner, but in the dark, I can't get there myself. So I've learned to ask for help when I need it. I make no plans for nighttime. A few years back, my husband bought me the new Apple Watch because it was, number one, I could see it, and it's set up where it tells me. I used to use Google Siri and ask every day, what time sundown? Now it's on my watch. So I know what time the satellite says sundown is. So I always know that 15 minutes before that, I have to be at home. I currently have 6 grandchildren, 3 girls and 3 boys. This is going to get rough. I hope to never get to the point that I can't see their beautiful faces. If I'm standing in one room of my house and they're in another, I have a straight through from like my kitchen to my family room, their playroom. I can't see their faces when they're that far away, and I'll have to say, Livy, where are you? I'll have to call their name, and I can see their bodies. But I never want to get to I'm hoping that I'll never get to the point of not being able to see my grandchildren's faces when I give them a big hug. So at this point in time, between month to month of the doctor's visits, when there's something that's a drastic change, I do make a note of it in my phone so we can discuss it with the doctor when I get there. And then I just become more conscious of it. I'm very aware of different things that go on with my vision. And I do feel that to survive this, you have to learn to adjust to it. And you have to learn what you have to do to accomplish the things that you want to safely accomplish. Fortunately, the doctor's office visits were not interrupted for injection patients. Where it did interfere, the doctor I was going to when this started, unfortunately, became very ill, and I had to switch doctors. And the one office was a very comforting family type atmosphere, and they would continue to allow my husband to be with me. When I had to change offices, it's more of a larger institution, and my husband can get me up to the office to make sure that I find it because the place is huge, and then they ask him to leave. And that's very hard for, I've gotten used to it, it's very hard for him. He is my sole support, and it's very difficult because he likes to hear what the doctor has to say, because he says, and I'm sure it's true, even from the professional standpoint, I only hear half of what the doctor says, because if something negative comes out, or if there's something that has deteriorated, as soon as I hear that, I stop listening. That's what I focus on. And that's very common in patients. I usually have to get one of the technicians to then help me with my phone if I don't remember to bring my husband up right before he does the injection, because then I send him a verbal message, come get me, because I'm now numb and dilated, so I can see nothing. I've walked into walls, I've walked into a door from one of the locations because I didn't know it was there. So I literally don't move. So one of the technicians will take me out to the checkout booth. So I send my husband the verbal message, come get me. And within a minute or two, he gets up to the office because he has to schedule the next appointment because I can't see the phone to do it. So they kind of forget that I'm by myself. They've just given me an injection. So I'm numbed, I'm dilated, and I have no vision in the other eye. And they forget that I can't do these things by myself. So I do find that kind of frustrating. So I look for my husband to one day be able to be back with me so I don't feel so debilitated. I think the most important thing for other people in my position to realize, and that includes families, nobody can understand what a person dealing with macular degeneration is experiencing, because I think everybody experiences it differently, depending on the degree of the disease, the damage from the disease, or just the way you're afflicted by it. So you have to be willing to explain to people what you can do, what you can't do. And people have to be willing and understand that they have to let you do what you can safely do. It's wonderful for people to want to always be there to help you and to keep you safe. And as long as you're safe, do everything you possibly can, because it's the way you learn to adjust to the changes and differences that are going to occur in your life.